Yes.
Make this a little bigger for me on this side. All right. Well, good afternoon, everyone. I'm ready when you are, Andrea. All right.
Yeah, we're already recording.
Okay. Good afternoon, everyone. I am Dr. Ericka Horne. I want to take this time to welcome you all back to our second part of our community engagement series, Community Voices in Research, a panel on engagement and partnership. And just a quick overview of what we'll be doing today. We're going to go over our objectives for today, and then we'll do a quick recap of last week's workshop. Then I'll introduce our panelists, and we'll have our panel discussion. Before we go into some moderated questions, we're going to leave the floor open for you all to ask questions to the panelists prior to. And if we have time, then we have some additional questions that we could go into in the topics of understanding community context, trust, reciprocity, and impact, experience with academic collaborations, and then any advice for faculty members. So for today, our objectives are to, one, validate and refine engagement ideas through different community perspectives. Secondly, to learn what trust and reciprocity look like in practice. And three, hear direct guidance from community partners to shape future collaborations. So we're going to do a quick recap of the first session that we had last week. And if you were here last week, can you in the chat drop a one or drop a one if you were here last week, just so we can see who all is in the room with us today. Okay, so we have a few people returning. Awesome, awesome. So this should not be completely brand new, but in the event that you may have missed some of what we went through or just need a quick reminder, we'll go through that briefly. So first, we talked about the foundations of community engagement, and that community engagement has an interdisciplinary background, bringing together multiple disciplines, including sociology, political science, epidemiology, cultural anthropology, organizational development, psychology, social work, and others that are essential to developing partnerships. After we talked about the foundations of community engagement, we then went and talked about the traditional research versus community engaged scholarship, and how with traditional research, it's a top-down approach where the scholar is the expert, as opposed to when we come to community engagement and we're now sharing power with the community and the community is the expert. So instead of us coming from the academic lens of where the outputs are journals and conferences and presentations, where the community is the expert and the dissemination may look a little different. It may be video, it may be audio, it may be visual, it may be in a community center, it may be a training that's developed as opposed to, or in addition to some of those traditional outputs. And then we went over those 10 principles of community engagement. We were reminded that last year they did increase from 9 to 10, according to the CDC. But those 10 principles are: one, being clear about your purposes and your goals of engagement; two, becoming knowledgeable about the actual community that you're working in; three, building and maintaining relationships and trust with your community partners, community leaders; and four, accepting that collective self-determination is the responsibility and right of all people in the community. And the fifth one was to establish a partnership within the community. And we talked about different practical steps and how that looked. Now, the sixth principle is to recognize and respect the diversity within the community that already exists. So we're not going in and just going to try to make a change, but we're taking hold to recognizing what already exists within the community and respecting the diversity that they bring out of themselves. Seven is identifying and mobilizing community assets and strengths. So it's ensuring and helping the community see the power that they have within themselves, so that decisions and research and things that we're doing to help the community are actually sustainable and can be held on long term. The eighth one is to release control and be flexible. With the ever changing landscape of this world, of this country, there's so many things that are always changing. We have to be able to release control and be flexible to what changes are being needed in the season that we're in. The ninth one is to foster community collaboration. So not only just being partners with one person, but allowing the community to realize that they have power within themselves, helping them to find ways to help collaborate if that's what you bring to the table. And the last one is to demonstrate trustworthiness. So it's showing up, being present, being relevant, it's being a voice. And even if the funding isn't there, or just going on beyond the funding, being there, it's showing up, being a face that can be trusted beyond what we may be thinking or looking for in our specific research agendas. And then the last thing we talked about were different models of engagement. And so that can look like community-based participatory research. It could be service learning or engaged teaching, where we're actually active in a project. If you're teaching and you have students, getting them engaged in the community work that you're doing, that's a way to help with sustainability of some of these projects, to help with building trustworthiness. And then it's translational research with community impact. So all of the research that we are doing that we know comes from like the bench, how do we bring it back to the community? How are we able to translate that information so that community members are actually receiving the good things that we are learning or we are researching? And lastly, we talked about building partnerships. So identifying and approaching community partners, establishing trust and those shared goals. So not only what we want to do, but what is important to the community as well. And then establishing trust and those goals, and then navigating those power dynamics and reciprocity. We want this to be beneficial, not only for the researcher and not only for the community, but we want it to be a reciprocal relationship where both parties are benefiting from the work that's being done. And we talked about two different activities that can be done when you're trying to map out who those community members are with your research, and then making a toolkit or just a list of how do we determine who those important researchers or community members are for the work that we're doing. So as we're talking about building partnerships, today I'm really excited. We have amazing panelists that are going to be sharing with us. We're going to go ahead and meet them, and we're going to spotlight them after I've introduced all four of them, and then we'll open the floor for you guys to start with some of those questions after they do, if they want to do an additional quick introduction. So first we have Talithia O. Edwards. Talithia O. Edwards is a community development expert, urban planner, coalition builder, and nonprofit executive with over a decade of experience advancing equity-driven systems change. She serves as executive director of Good News Outreach and is the CEO of, is it T.O. Edwards Community Development Consulting? Did I pronounce it right? Okay. Where she leads initiatives focused intersections of housing stability, food security, reentry, and community-led planning. Talithia is nationally recognized for her ability to bridge policy, grassroots engagement, and leadership development to drive sustainable impact. Next, we have Ms. M. Maisha Mitchell. She is the Executive Director of the Greater Frenchtown Revitalization Council and a co-founder of the Tallahassee Food Network's I Grow, Whatever You Like youth farm in the historic Frenchtown community. A lifelong advocate for justice, equity, and service, her leadership advances community-based participatory research, collaborative partnerships, community engagement, and health equity across local, regional, and global contexts, bridging grassroots knowledge with systems-level impact. Ms. Maisha previously served as director of the Commission on Minority Health for the state of Florida, where her work informed policy recommendations that contributed to the establishment of Florida's Office of Minority Health and the Institute of Public Health at Florida A&M University. Her leadership has received national recognition, including a CDC-recognized best practice logic model for diabetes education and screening among African Americans. Throughout her career, Ms. Mitchell has championed interdisciplinary mentorship and applied learning across public health and anthropology, agriculture, journalism, medicine, and social work, partnering with organizations such as the Health Equity Alliance of Tallahassee, the Childhood Obesity Prevention Education Coalition, the Florida Blue Foundation, and the American Cancer Society. She was recently a recipient of the MLK Community Champion Award presented by the Leon County government, as well as the Reuben Askew Progressive Leadership Award for Community Service, recognize her enduring commitment to equity, beloved community, and transformational leadership. Next, we have Dr. Shamario Roberson. She is the executive officer of DSR Consulting and Management LLC, and founder and president of the DSR Public Health Foundation, and an expert in public health administration, certified community health worker, and epidemiologist who previously served as Deputy Secretary for Health at the Florida Department of Health. She brings demonstrated expertise in policy, program development, evaluation, research, and performance management. Dr. Roberson possesses extensive knowledge in community and environmental factors impacting health, crisis response, chronic and infectious disease, state and federal rules and regulations. She is skilled in implementing evidence-based strategies to foster cross-sector collaboration to address health and human services issues, leveraging funding and driving policy change to improve health outcomes. And we have Ms. Kimberly Wiley. Kimberly Wiley is the director of the Fort Braden Family Resource Center, which is managed through the Children's Home Society. She graduated from the University of Florida. It's a little bit hard to say go Gators, with a Bachelor of Science in Family, Youth, and Community Sciences. In her role, she has the opportunity and the privilege to lead prevention-focused efforts that support children and families through concrete assistance, education, employment support, and strong community partnerships. So I'm going to go ahead and stop sharing my screen now, and we'll spotlight our panelists to get started. If you have any questions, feel free to either, I'm sure there are a plethora of questions, feel free to drop them in the chat, or you can come off mute. And while you're gathering them, Andrea, are you able to help me spotlight?
Yes, just give me a second.
Okay. I want to make sure you guys are spotlight properly so they can see your faces as you're speaking. So as we're getting them spotlighted, I'm going to go with our first question as we're preparing. The first question is going to be, what does a meaningful partnership with researchers look like to you? You can remove the spotlight on Abria. Okay, so the first question is, what does a meaningful partnership with researchers look like to you? And we can go in any order.
Okay. Talithia, I guess.
Yeah, go ahead, Talithia. You're on mute.
Okay, yeah. It's when you all spotlighted us, it took me my ability to take myself off mute. So how y'all doing today? This is a really great topic. And I've been a part of a lot of academic research in some great places. I do think we're still evolving on how research and academic educational institutions are, engaging with community and what that engagement really looks like and how robust it can be. But I'm pretty sure we'll get to that topic. But I think it looks like I participated with the University of Pittsburgh at the start of COVID with an Active 6 research where we were testing already on the market drugs to treat COVID, and like long-term COVID. And what I really enjoyed about that research, that it was really co-designed from the beginning with community members alongside researchers,
Mhm.
and the like from the language, the pictures, all the things. And we started with information and data from community, right? What were community looking for? What were individuals saying? And we knew that COVID was starting to kill people, and people were concerned about testing a drug that was going to come out to then vaccinate us. So how could we use what was readily available to do that? So starting from concern the community, working along side researchers, and then taking input along the way. And while developing the marketing tools that was happening in that research, again, working with us as an advisory team to, ensure we changed language, we changed photos, we changed a lot of things. And I think that's a really, really important piece of it, but it's also compensation of community. I know you didn't show that on the 10 principles of community engagement, but the extraction of our information from our communities. Like I know I show up many places and I'm listed as a community leader. I'm an expert in what I do. My not only my lived experience, but my training that I've received have made me an expert in these areas. And so it's learning how to switch those titles, using our professional titles, that capacity building that actually takes place. Um, and I've seen that in many places. I work with Harvard on in the Center for Developing Child on their stress reduction and community, right? So learning how do you do that in a way that balances what the researchers need and the institutions are getting, but how community members who are involved in that research and are helping shape that research, and then also those who will be recipients of it. So I know I added a lot of elements in that, but those are some of the important components of seeing research done, and it can be done, quote unquote, the right way.
Yeah. And
I'll go next.
okay.
Well, I just want to highlight an area that was very sensitive in the beginning for us and work with the University of Florida. The idea of an IRB, Institutional Review Board, having to have presence in a community before you can do any research was essential. And we found, though, that I found, let's say, that one of the best things that could have happened was that idea of respect for different ways of knowing. And the idea that the researchers brought with the RRB had already been formulated. So when you got to the community, our ideas were quite different in terms of how you go about addressing this. And as a result, we were able to work with the National Science Foundation and the University of Florida RRB community to review that in depth based on our initiatives and the kinds of ways we saw it from our perspective, and then we're able to make some changes and modifications. So we had to extend the grant over a whole year before we could actually get to doing the work. So I really relied on that initiative because it allowed the community and that team from the university to build trust over that year and understanding the different ways of knowing.
Yeah, I'll go next. So I'll talk about a recent example where I'm working with Dr. Penny Ralston at FSU on a adaptation of youth health leadership in rural communities. And so youth health leadership started long before with a partnership with FSU and FAMU, looking at physical activity, nutrition, obesity, other factors contributing to health outcomes, and really taking a three-phased approach of educating youth to make it simple for phase one, phase two, interacting with health professionals, et cetera. And then phase three, like having the youth come up with a scientific project, et cetera, to actually present like and learn how to do research methods. So I engaged with Dr. Ralston. We worked. I looked at the cohorts that they had done in Tallahassee and in other counties, but it was really different when we implemented the first cohort last year in Greenville, Florida, in Madison County, because it was a rural area. So things that had been done with this research project before was very different in a rural area. The socioeconomic status of the participants were significantly different. And so what I'll say about that example is Dr. Ralston, and working with her, she does nothing for the community without the community. So she brought in, from the beginning, people who had previously been a part of youth health leadership with the previous cohorts in other places. She gave ambassadors for us to hire, on the project. In addition to that, she came out with us to the communities. So she showed up at food drives, at other events, so she could get to know the community. But she engaged my nonprofit to actually be the, nonprofit to disseminate the program. And then she worked as the evaluator. So again, making sure that she truly understood the community, but bringing together an organization in the community to help educate and run the program was a little bit different. But that made it where there were trusted people from the beginning, from the community, in the community, that was delivering, the youth health leadership program. And it was adapting with the youth, using surveys, using key informant interviews, for example. So it was adapting as the program was going so that we could create a program that had the evidence-based framework, but was adapted in real time to translate in the field, to be able to serve the youth that we were serving.
Right.
Yeah, I'm gonna piggyback on that because we've been working with actually the DSR Public Health Foundation in the Fort Braden area. And, a lot of community engagement and the research, I know that prior to the Family Resource Centers of Leon County opening, they did a lot of research with logic models, going off of other family resource centers in the Florida area, specifically Tampa, where they have funders, that they have 7 FRCs down there, and seeing in different parts of different communities, and so really learning about our logic model and what those 5 protective factors that we use. For myself out at Fort Braden, we did a lot of work in the community prior to us opening the Family Resource Center to really get the community engaged, and adapting to our different areas. We have one over at Cross Creek, and that looks different than the rural community at Fort Braden. And so really bringing in the community to help. I've had community members facilitate, new activities or new workshops, and really having them headed up, that really gets them engaged. So I think that adapting to the community and the needs of those community members really just helps them become trusted in us to do what they are wanting in the community.
Thank you all so much. That was so good. You guys hit on so many key points already, even the ones that we talked about and some we didn't talk about. I wanted to highlight a few of them. Like we talked about being flexible and adaptable. The community may change, the needs may change if there's an emergency crisis situation, and you have to be able to adjust to what the community needs. But even just talking about compensation for your community members. And when we talk about reciprocal relationship, it wasn't explicitly stated like you must pay your, community members, but this is, they're the experts. This is their lived experiences they're bringing that you're needing for the work that's being done. So what does compensation look like in your research? Are you even looking to make sure that that's a part of your budget request? Like you're making sure that those who are working, involving community organizations to help lead some of those efforts. So thank you all so much for sharing some of those. And even when Kimmy brought up about logic models, I know I talked about Ms. Maisha and her logic models, and just teaching the community these different tools that help them to help the research better, that helps their community when they're able to learn certain tools and certain methods that allow them to then continue to strengthen their leadership in their respective communities. So thank you all so much for those answers. If there's anything, if you do have any questions, feel free to drop them in the chat or raise your hand. I can't see if hands are raised. I realized that after I put it in the chat, but if you do have one, Andrea, just stop me. But if not, we'll go on to the next kind of topic. So everyone really talked about trust already. And so this next set of questions is about trust, impact, and reciprocity. And my first question is, what builds trust between communities and researchers? Like each of you mentioned how, you were involved in the research or adapting the different models or what currently exists. But what exactly in day-to-day practice did it look like for you to be able to say you trust these researchers that are wanting your input, that want you involved because of your expertise? They come to you, they see you as the community leader, they see you as the person that helps make decisions, but what practical steps helped in building that actual trust between you all and what the researchers were doing. And I know sometimes we wear both roles, both hats, because we're in community.
Yeah.
So, you know, that's a
Right.
little helpful, you know, because we're in
Right.
community. But then if we were to go into like another community, like what is that like to help, you know, what helps us to build that community and build that trust with those who are not in that same community or who may not have the expertise that we may have?
I think like building trust, like having lived experiences, and I tell people this all the time. Like I grew up in a multi-generational household in a community, median income $25,000 or less. Like I'm a first generation college student. Like I have lived a lot of the experiences of the people that, I'm working with now, and my
Right.
family is still there in these communities.
Mhm.
My friends are still there. So I tell people you have to put your service where your heart is. And you have to put resources back. So if you're going to be a researcher, but you're only going to pop in to do research and ask a question, that's not true community engagement. You
Mhm.
have to be willing to not only come for research, but you got to come for the things that matter to them too. So if they're doing an event and they're promoting, a back to school drive, or if they're promoting a food drive, you don't just come to do research on people. You have to come to love the community. So that trust is coming from genuine people. Like people can tell if you truly love them, if you're truly there for the right reasons, or if you're there to just take something from them and like pop out the next week or the next month. So I think that trust comes from making sure that your heart is in the right place, that when you wrote that proposal to do research, that you truly thought about it, you cared about it, you put money back in the community, because every research study that we do, we always talk about low social economic status,
Yeah.
have poor outcomes. So we know that. Why would we come and do research and not place in the budget to put money and resources back into the community? Because otherwise we're going to keep seeing the same results. So I think, making sure that you truly care and you're genuine and you're doing the research for the right reason, that's how you gain that trust. Because I'm not going to have a researcher come in my foundation in Greenville, Florida, where I have very vulnerable populations that we're working with. But people approach me all the time, and I'm like, why do you want to be here?
Mm.
What interest do you have? Like, why this community? Are you coming to me because rural health transformation money is coming now and you
Right.
work with me? Where were you a year ago, 5 years ago, when I said this, 10 years ago? So, what are your motives? And that kind of drive whether or not I trust people to want to work with them.
That's
I
Wow.
agree.
like,
I had nothing to say after that one. That was everything. That
Yeah,
was perfect.
I think what came to mind was showing up. So, like being present is it just shows the care that you have for whatever you're doing, whatever that looks like.
yeah, Dr. Robertson hit it on the head, so it's really nothing to add, but I will give an example because I think we should give kudos.
Mhm.
Um, Dr. Nicole Patton Terry is a great example of a researcher that shows up in everything Dr. Robertson explained and said that trust building looks like.
Right.
That's exactly what she is. She came into this city more than 5 years ago, asking questions, listening, and developing her research questions around community
Mhm.
needs. Like she's in the schools that she knew, right? She's a researcher. She's leading a reading and literacy research department. She knew she needed to ask these questions. She was studying it, but she came in and built that trust. She put her hands and helped solve problems that was not related to her research because researchers do have lots of information or at least connections in ways that sometimes community don't have it.
Exactly.
And so I've seen her in so many ways show up in exactly the way that Dr. Robeson has asked. And even identifying um, resources to place with some of the problems, right, that aren't research related. And that is the ultimate trust building. So you get a researcher that say, okay, now I'm doing research and I need to ask you a question. You've worked with this person. This is a friend. This is a partner. It's not just an extractive, real transactional place. So I just kudos to
Yep.
Dr. Pat Terry. She is a rock star in this area.
Yeah. One other thing too I did want to mention was that we found with the CHW training in promotores that one of the things that came up all the time with them was that the relationship, like you don't even know me. How important is that, in building the trust and building a foundation but doing the work in the community. So I think someone said earlier, maybe it was Wiley. Yeah, you were talking about finding out what's going on in the community prior to, doing the actual work. And that does help. And so that showing up piece, being where people are, Dr. Robertson spoke to that very clearly with her example with Dr. Ralston. That is an ideal way you have to go about building those relationships with people. So they see you. And then once they see you and they know that what you're about and you respect what they're about, then you're bound to have a better relationship moving forward in your work.
Thank you. Thank you so much for that. I know there were quite a few gems. If you missed it, one that stuck out to me was put your service where your heart is.
Yeah.
Make sure keep that deep, like put your service where your heart is and
Mhm.
come for the things that matter to them as well, not just what matters to us as researchers. And I think that lends into this next question about what can faculty members or researchers do to ensure that their work does benefit the community? So I know it does start, like you say, showing up. Okay, so now I've shown up. Okay, how do I make sure that it is actually going to be beneficial? Yes, I've talked, yes, I've spoke to a few people here and there, but what do I get to do? Like, what do I do to ensure that your voice is heard, even in the research and the questions and the responses? What does that look like, and how can we help those future researchers? I think on the call, a lot of the researchers, they may be newer investigators, or they're looking to apply for like large grants or NIH grants. And we know those are really large and there's lots of components to it. So what are some things that you can help share with them to kind of ensure that the community is going to benefit, as you guys mentioned, even though they're looking at all these pieces to this large proposal that they may be trying to get ready to submit?
Dr. Blackburn, I think that's her iPhone in here that just said, working with the community from the very beginning. I
Mm.
talk about co-creation all the time, right? That flat hierarchy, sometimes walking in, again, I'll dovetail on Dr. Robeson when she said, have lived experience, right? You're going in with lived experience. You are a researcher, but how do you relate to these areas in which you're going in? But co-creating those questions, it's okay to want to research something and not have concrete what I'm going to ask yet, right? Going into community listening, letting those questions kind of surface from conversations with community or writing your questions. I remember, I don't know, Miss Maisha, you remember when we were doing the South City questionnaire, the health questionnaire, we had come up with like 60 questions. And community was like, we don't got time for that. Like these are 5 questions you can ask us, and I promise you, you'll extract all the information you're trying to get. So I think that's important with considering when you consider co-creating those questions and asking them where you're gonna ask the right question that you will get the right
Really.
information so you don't have to ask 20 questions. So I think that's a real important thing that young researchers should consider.
And
Yeah,
another
I like
thing,
that part, Talithia, that you're saying, because everything is flexible. And Dr. Robertson talked about evaluation, her background. Evaluation is critical, so even though you're doing the evaluation, most of the time people do it at the end, but when you start out in the very beginning with the process and constantly knowing that things are going to change, that your evaluation takes a different approach as well. So I think understanding the value of that, really makes a difference. And when you come into community to think about what they're saying, put that to your notes in your head, target it however you want to, but making sure you're coming back to that again so that they don't think you've forgotten what they said, evaluating what their thoughts around that, where did it go from here. So that's a key area for me. I find sometimes you go away, we just do the work and not do the evaluation and come back and say, oh, did we get it right? Come
Yeah.
back again, to make sure that the folks are understanding where you are with this aspect as well as you're understanding where they are.
and I'll say like truly listen and implement. And I think that's one of the problems that a lot of researchers have. Like they'll get information from the community, from stakeholders, from trusted members, and they still just go about whatever plan or
They
proposal
had.
they had. They took in the information, but they didn't truly apply it.
Mm.
And on important calls and in making important decision points and budget changes, et cetera, they never involve those stakeholders throughout the process. And so I feel like once you take that information in, you got to ensure that you listen to these people and that you implemented what it is that they were saying. So I'll give you an example. For example, with youth health leadership, we hired youth from those communities to help adapt that curriculum. And what I mean by that is like, I'm talking y'all, we have students that are hired that are 14. We have students that work for the foundation that's 16, 17. Because if we're going to have a nonprofit that's going to focus on rural youth, at-risk youth, we need to hire them. They're struggling in these communities. There are not a lot of jobs, so we hire them. So, like today, we're adapting a CHW program for young adults, youth,
Yes.
right?
All right.
And so we're working with the Community Health Worker Coalition, myself and Taylor Humphreys, who's on the call. And so we are in the process of, we are certified trainers. I'm a certified community health worker myself, but we are working on creating a training program so that youth in these rural areas and other areas can learn how to be a community health worker. And then they can be a community health worker, but they can certify at the age of 18. And so we are working with them to develop the content. So I told the team today, training number one that we train for community health workers, send it over to the youth that's in the program. And before we even teach it, like, do these pictures resonate with you? Is this language, can you understand it? So that as we're running this pilot on our first cohort of youth for community health worker training, I want to make sure that we create a training with the youth for the youth and that they have the opportunity to advise on what's going to work best for them.
Yes.
Awesome, awesome, awesome. You wanted to go, Kimmy?
I can, yeah, I can piggyback on that kind of that information with really the surveys that we do are wonderful and great, information to have, but also listening. I mean, a lot of what, I did in our community is, yes, they did the surveys, but also things change over time, right? Like new things come up where the community may say, oh, you know what? It may look better if we did this, this, and this instead of, and so having the community be part of that has been really key to the family resource centers of Leon County. So adapting in that way and looking at, a year ago, I had 200 families do a survey, but now, in our rural community, it may look a little bit different. So going out there and continuously asking the community, what does it look like? How can we do, I'll give you an example just because I love my community is, a family wanted dance class. It's simple as dance class, but we live in a rural community and driving 50 minutes for a dance class and then driving 50 minutes home is not always doable. And, I had a family reach out to me and she kind of wanted to head it up, and I gave it to this community member to get a list of families that would be interested in dance for our little kids out here. And it kind of organically happened, and now we have ballet and tap for these kids that can't travel, an hour and go to class. And through the Family Resource Center, we're able to help them in different ways, whether it's financially or commute. And youth development, all these things that they don't have access to. So really continuously asking the community and getting them to be part of it, because really, if they want it, then let's go do it, right? Have them be part of it has been a huge factor in our success so far.
If I can say one thing, Kimmy, you hit on a very important piece about, you know, community is the asset, right? So we have a lot of great frameworks that we use, but I think also looking at them and what's missing. So I went and became an urban planner because I led a resident-led planning process, and I felt like there were missing pieces for my community, right? Not that these frameworks were bad, but they had not considered some of the elements and the cultural aspects in my community. So I wanted to learn these technical pieces. And even as I was in planning school, I'm like, there's still a missing piece. And so I have a conceptual framework called a starfish framework, and it really turns the ABCD model on its head, and it centers not institutions and places as the asset, but the individuals as the asset. So your story was perfect to that when you think about what is needed, right? And when we recognize the community as the asset, having the answers or whatever it is, and then how do I resource that? How do I then build capacity? How do I then replicate that? So I'm not creating tokenism where we're talking to the same person over and over and we do it again, right? And so individuals are continuing to grow, they're continuing to move on. Community is continuing to stay the focus in the center, right? This kind of place-based approach, but again, flipping all the models we know on its head and looking at community as its asset, as the greatest asset. And your story was perfect about that. So I do think that new models and new frameworks paired alongside because each community looks different. I'm really excited about all the rural transformational money that's coming down the pipe. But when I think about rural areas and impoverished low income communities that are in the cities, we match each other, whether we are in the US or in
Yes, exactly.
another country, right? And so I'm super interested in us taking resources to actually begin to go deep down to that grassroots community as the asset level to work on these issues because that's the early change space, right? Where we could do lighter, quicker, cheaper in a way to change because we know that populations and system change takes 10 to 20 years. Right, 10 to 20 years. And so when we're going to communities, we're asking these questions. They don't know that. They're not aware that change happens at that slow of a rate. So how do we begin to, look at different models and different frameworks and fund those, right? Those concepts because we got to do it in this early change space because the population and the system change is going to take a while, and community do tire out of us. Researchers turning over and asking the same questions, generation after generation.
True.
And I just want to like we have a lot of researchers on the call, so I want to talk about the concept. That's why I'm happy to work with my friend Talithia. But the whole concept of when you're in these rural areas and there's a lack of resources. So in the zip code that I'm working in now, a lot 32331, they don't even have a grocery store. So my nonprofit is will be the operator of the first grocery store that's going to open in over 20 years. And we've had to work to identify resources to finish that grocery store. And that's what we're working on right now. And it'll have a minute clinic in it. It'll have a pharmacy in it. We're going to work with our FQHC partners, health department partners, etc. We don't have a lot of researchers because we're working. There are not a lot of researchers that are doing research in these areas. So we could use additional partners. But here's a key thing right here that Talithia said when you're talking about we don't have 20 years to implement something new and change it. Like all we know right now is we have 5 years on this funding opportunity that's going to launch and come. And so, with that being said, there are some resources that reside in Tallahassee that you could serve a Madison County or a Taylor County or a Jefferson County or a Gaston County, for example, but so we don't even need to recreate it. We're talking about a population of less than 1,000 people. So if Talithia has at her organization a way, I'm just going to use an example, a way to get car seats or a way to get household items for people who've had a fire or whatever it is, it doesn't make any sense to establish something new in a rural area to get those resources. It makes more economical sense for us to like have the transportation that we need as a part of this grant and take those resources of something that's already established and push it down to that population. There's no need for us to reinvent the wheel. We need to take some of these lessons learned in these same communities that have some of the same factors that they're dealing with and then deploy that in rural areas because there's a lack of transportation. And even though resources oftentimes in Tallahassee can be afforded to these, different groups of people in the rural areas, they don't have a way to get it. And there aren't organizations that have constant transportation to move the resource. So that is something that I want us to work on so that we can truly maximize the funding and not spend the same funding that we have to do something that's already being done in Tallahassee.
But I think that the one downstairs, that's one I always use for it.
Awesome. This is really good. Does anybody else want to piggyback again? I was loving the little piggyback and forth. It was going really well. Great. I know there was
So I do have one piggyback I can say.
Yes.
Is that the resources, and sometimes we have to be very clear too about that. Equitable distribution of the resources that are coming, like I said, between the community and the university is very important. So when it comes to being engaged in these grants and having people written into a project, when you look at the budget, you really have to think twice and harder about how these resources look in a community, what they may need, and be equitable in the distribution. It took us a minute to do our IRB with the University of Florida and National Science Foundation because they didn't want to hear much of how the community saw their value, and that lived experience and our different ways of knowing does not mean we are not expert in what we know. We have been there, done that. And so our value to that process has just as much weight as the PI who comes in. So we could serve as a co-PI. We could serve in various capacities so that you can lift up the families in the community so that, 10, 20 years down the road, we may see some difference. Now, we've talked about these things over 20 years and things are still the same. The data is still the same. When you look at how maternal health and infant mortality rates and maternal deaths and diabetes, obesity, we've not seen sufficient changes. Although the conversation has been going and the research has been forwarding. So think highly about what we talk about when we say equitable distribution of resources. Put the financial spin to it as well.
Awesome. Thank you so much for sharing that. This has all been great. Miss Kimmy did just have to step out. She posted in the chat. She is back on duty. She has someone come into her resource center. But if you do have any other questions specifically for her, her email will be shared so that you'll be able to reach out to her for any of the other researchers or panelists as well. There was a question earlier about community. I know we've been talking about community and we're saying community, but it may not be clear. So when we're talking about community, what is community? Which community are you referencing? Because I know depending on who your, not necessarily your target is, but who your research is around, where your heart is, it could be different. So when you guys are saying community, what does community mean to you? What does that look like?
Yeah. Well, it's the community is dependent on who you're researching, right? So it may not when I show up and I'm representing my community, I'm talking about my Southside community, my community as a mother, or right, like those different places, different roles I would come in as. And I think that when you think about community, is who you're researching, because we're talking about research. Who are those questions affecting? Who would the outcomes benefit or adversely affect in that matter, right? So those are the communities that need to be represented when we're talking about research, and being mindful that we are targeting the right community, regardless of not a geographic location, but the target population. When I'm saying community, in the scope of research, is what I'm talking about.
So who is your community? I would say also who do you represent?
Oh,
Just in case others on the line. I know I shared a beautiful bio, but you represent more than what was in your bio,
definitely.
So yeah, go ahead and share.
Right. I represent Southside Tallahassee community. That's where I live. That's where my impact zone and my work is happening. I represent birthing mothers. I'm a doula, right? I show up in that space. I'm a planner. So not only am I a resident, but I'm a planner. That is my community. I do believe that's a whole conversation about what I think about urban planning. But I show up as a planner. I do believe people in place go together. So you can't have one without the other.
Mhm.
It's just a lot of places. I'm an educator. I serve as the chair for Leon County Title I Advisory Council, right? So I'm showing up in that space as an educational advocate. That's my community. So when you think about where you're showing up, and those it's intersections in that. So you're not always being able to separate what community is being represented. When I'm showing up in a maternal health community, I'm showing up about mothers I've represented, but also myself, right? My
Mhm.
last child that I birthed is 11. And the system has changed, even when I go in rooms with individuals that are having babies today to offer that support, right? So I'm coming in, and again, Dr. Roberson said it so beautifully that with that lived experience, I'm coming in, but I'm also coming in as an expert as well. And that beautiful blend makes for amazing communities when you talk about adding individuals that can come from a lived experience perspective and as well as an expert, or trained professional in that way. It just makes the space so much, the community so much more robust.
Yeah. I
Yeah.
consider myself a pracademic, right? So I practice public health. I'm an epidemiologist by trade. I'm specifically a spatial epidemiologist who focus on where place and data meets to drive health impacts. I'm a certified community health worker. Everybody that know me ever since I've been at the state, I've lived in Tallahassee for more than 20 years, but I work in rural areas. That's where my grandma's houses are. That's where my family, resides. So I am a part of the community in these rural areas in Madison County, and then I work in Gaston County, Jefferson, Taylor, Madison. My mom was worked at the health department in Jefferson County for 30 years. So I grew up living, breathing, walking, talking public health before I knew what public health was, because that was introduced to me back in
Mhm.
the 80s. So when you say community to me, and I'm from a rural area, like community is everything to me. I'll give you a real like lived experience on this. So I was a deputy secretary for health for the state of Florida during COVID. I've been the chronic disease director for the state of Florida. I'm the chair of the board for Family Promise of the Big Bend, which that's our only emergency shelter for children in the Big Bend region. And we're working on housing with homeless vets and expanding that service offering. But when we say community, when I was a deputy, my mom was my grandmother's caregiver during COVID, and I tell people this, all the time. They knew first of all, the first time they ever popped me on TV with the governor, et cetera, people in the country on Facebook started to pop up. There go our Tootie. Tootie is my nickname, right? But the comms team, they said when they saw it, they were like, who are they talking about? But they quickly saw because people were like, that's our girl from Madison County. Like, that's
Mhm.
community girl. That's our tutor. When you were in school, they don't call you by your name in the country. They call you by your nickname. But
Mhm.
sense of community is people said, you guys don't have a grocery store. But I tell people, you might not have a grocery store, but you'll never be short of a meal in my hometown. And what I mean by that is, even if you don't have the food, even if food is a little low, I promise you right now, in the next 10 minutes, if I popped up in my hometown, I can call three people and say, can I bring a set of my friends over? They in town. Can y'all cook us something to eat so we can sit down and
Yes,
talk? They don't have restaurants there. But I promise you, I could call
that's true.
somebody, we can jump in the car, they'll have us a meal done in an hour, and they'd be glad to do it, and we could sit down at their table. When my mother died, who was my grandmother's caregiver during COVID, they said, Shamario, we don't have traditional home health care. People are hard to get CNAs from these agencies
Mhm.
and this.
Mhm.
They said, go back to Tallahassee. It was July 2020. COVID was bad. Her neighbor said, we will bring your grandmother breakfast, lunch, and dinner. We will give her a bath. We will take care of her. You never have to
Yes,
worry one day while
yes.
you're on the road on whether or not we're going to take care of Miss KK. They said, we promise you that. And if
Mhm.
something is wrong, we will call you. But if nothing is wrong, just know that we're sitting with her, we're feeding her, we're taking care of her at her house. And if
Absolutely.
we see where she can't stay here anymore, we'll let you know. You come on the weekend, baby. And I'm like, hey, I can give you some money to do that. They said, Mm-mm, mm-mm. That's an
Right.
insult. That is like when people say community
Beautiful.
to me, faith-based organizations, churches in those areas, like truly they are the trusted members. So the community rallies around you. So when somebody talk about community, the community taught me everything. They taught me public speaking. They taught me how to leverage resources. Somebody said to me recently, Shamari, you grew up in a community with not a lot of resources for, lessons, for music, for arts,
Yeah.
etc. And for a minute, I thought about it and I said, you know what? Through
Mhm.
churches, through community events, through school, I had everything I needed. And I went on to get a doctorate degree in public health. And I was just
Yeah.
out of one of the worst educational, if you measure it by traditional measures, they say Madison County is one of the worst in the state for education. But because of that community, I had everything I needed to effectuate
Huh.
change.
That's community, all right. Full
We had to.
definition in total. Thank you, Doc, for that. I,
Mhm.
I swear, you hit on everything I would want to say. All I want to add to that is that it's an element called love.
Yeah.
That right there, it says it all. So when you talk about your heart, I keep putting up hearts for you because I recognize that the things that we're talking about today has to do a lot with our love for our people. And because when you love people, you're able to do the things you talked about very easily. And so resources are unlimited. They're bountiful, in everything we do. So in my case, it was around food. I love food. I do a lot of work around food security. That's my community. I love to give people, I make sure they have healthy meals, but I'm a health administrator by trade. And because of that combination, I understand hospital administration and all those things, but I also understand that it has to be at a community-based level to experience the kind of love we're talking about. The healing that takes place when you love people is a lot different when you're in the academic situations or in the institutions. So we have to rely on both the medical approaches that come out of those, but also the people who have their own approach to taking care and loving people. And we cannot ignore those kinds of compliments that go into complementary medicine. That to me is a missing area because we don't want to recognize some of that. And that even though we get our medicines, oftentimes we run home to grandma and we get something else. And that's because it's made with love. And those concoctions, that they call them, or the things that have brought many of us out of some of our areas of need in terms of our conditions and just having people love us, bringing a healing touch. I've had people say they go to their doctor and they don't touch him anymore. Imagine what that means to a person who's getting old for sure. When you really go to your doctor just to have a conversation, mostly, you just show up because you want to have somebody you could tell your most immediate things to. So having that same kind of a relationship with your researcher is pretty interesting because they're carrying forth your message. So talk about your programming and your activities through a lens of love and a lens of equity. Because when you do the two of them together, there's no way we can fail in this process. That's what I want
May
to
I say
say.
something real quick to Miss Robertson?
Yes.
Okay. I just wanted to say just your experience. I just listened to your heart warm experience, and was just thinking that's the advantage of having a relationship with the population and the community that you're serving.
Mhm.
Me also being a native of Gaston County and being in community service for over 20 plus years. I recently became certified as a CHW and just in help trying to do whatever I could to help my community. I noticed a lot of disconnect between the resources and the community,
Mm.
right? And some of the resources that we have, I didn't even know myself. And I'm born and raised here, and I do a lot of, work a lot in resources. I didn't even know we had them ourselves. So I'm learning that a lot of people, they don't know the resources. And even the resources that they do know, they don't have the know-how to complete the forms, to fill out everything online. Because
Yes,
of course,
yes,
being in
yes.
Gaston rural area, the internet is horrible, and most people don't have that. So a lot of people, they'll begin to fill out forms and they will get so aggravated and they'll say, okay, I can't do it anymore. Like I'm getting the runaround. So how do you, any of you, how would you, and we are in a process of working on a resource guide for Gaston. So I do think that would help just to have something tangible for them so they can actually look over themselves. But what are ways that any of you could think of that we can try to help bridge that gap with the
And Ms.
things?
Allen,
Yeah.
we recently made with some CHWs and in conjunction with Mother Care Network for Gaston County. I work as a part of that with Dr. Souther and a couple of other researchers with Felicia Battle Jones, with Mother Care Network, Ms. Battle Jones. So we made a resource guide for Gaston County. We are more than happy. Some of my folks are on the call. We can share that with you. Feel free to add to it. We can have a call and talk about it as well, because programs like, community paramedicine help, the help program, you have a prescription, assistance program that's now at the health department in Gaston County. That's very different from Madison County, as a CHW, like some of the understanding the resources, that's different. But one of the things that I think, which I was happy to see this in rural health transformation funding, like community health workers, that is truly community clinical linkages.
That's right.
That is how you move from these people being able to get the resources. I'll give you an example. So the hurricane hit Madison County twice in the last 4 years. They've had two hurricanes. When I was growing up, we never had one, right? And so with that being said, there are programs to rebuild houses. You have Rebuild Florida from the Department of Commerce, but you also have groups like nonprofits, Madison Strong, who can help you get your house fixed. Like if you have air property, right? And so with that being said, these programs were advertised like on social media, maybe in the newspaper. But, I'll give you one case, an example. And I told my daughter last week on the holiday, um, I, I got the call that they were working on a disabled veteran's house. And so he said, I got denied FEMA assistance, individual assistance, and other assistance because I didn't have a valid ID. I'm a double amputee. I couldn't go anywhere. I don't have a car, don't have a lot of family members. I couldn't go anywhere to get my ID updated. So they denied me for individual assistance. And then he said, I know that you guys had, events and it's on the internet. I don't know how to use the internet to fill out the paperwork. And he said, you had an event at your organization, but thank God somebody remembered me and came by my house. So we knew that guy had a lot of damage. He still had a tarp. So we went to his house, and as a community health worker, we called a nonprofit on his behalf and said, hi, Mr. W, he's a double amputee. And then the nonprofit in that area said, we know him. He was working for the school board doing this and this for 30 years. But we were able to make sure his house is being fixed. It's almost done. They're there right now. But that's a true example of closing that gap because he didn't have the right paperwork, but walking him through step by step to make sure that that organization fixed his house because he didn't have a way
There you
to go
go.
to a community resource center to get his house done. And then he told several people that he knows. So we have active examples of making sure that these people can get their house fixed from the storm. They got roofs in, stuff, mold. They don't know the impacts of this stuff. But that is an example of working to make sure that the community get the resource. In our nonprofit, we don't get paid from anything. We're not doing any research on this or anything like that. We're just making sure that people can get the resource to fix their house while the window is open.
Exactly
Thank you
right.
so much for that. And that resource guide, is that through the Health Council in Gaston?
No, we made it, I made it in conjunction with Mother Care Network.
Mother
And
Care.
so we do work with the Health Council in Gaston County to disseminate our Sonati health screening program. So we work all the time with the Health Council to do a lot of different work, especially health screenings using the bus.
See, and that's a prime example of how sometimes the resources can kind of like overlap because the Health Council has been working on a resource guide now for maybe a few months now. But had we known that you guys already had one, that would have been easier to kind of like work
And we
with
work with the Health Council
and
almost every
update.
week. I didn't
Really?
know. I didn't know.
Yeah.
Dr. Gamage is on the call from the foundation, and they're always working together with the Health Council like weekly almost. So we'll close that loop.
Yeah, I would have said, don't reinvent the wheel. Let's go see what they have over and let's add to it. And
And
of
we
course,
have a student from FSU who's on the call, Whitney Leonard. She just started her master's in public health. She's on the call. She did a bachelor's in public health. She could speak Haitian Creole, and she was actually in conjunction with Taylor, who started that original resource guide for Mother Care Network to work with their faith-based organizations. So, we want to praise the younger researchers that's budding. And I tell Whitney all the time, she's a first generation college student. We've been working together ever since I met her at a forum at FSU, that this is the kind of thing that even though you might not be a 20-year researcher or anything, I have an example of a student who just started a few weeks ago, a master's in public health, and she started the base for that resource guide and has been growing on it ever since. So I love my young people.
Yeah.
that's amazing.
And that's how you feed the next generation. So I'm a translator and I say things very simple. Dr. Robeson said very nice and eloquent as the doctoral researcher she is. Like sometimes you got a handhold, right? And I just simple as that. When I say handhold, so I talk with my staff a lot about that. There's some people we gonna give them the packet, they're gonna feel like they're gonna come back. Some people we gotta walk that thing out. You gotta go to the door, you gotta introduce them to the next place that they're going to get help from. You got to tell them, call this person. Don't talk to that person. Talk to this person because you want to reduce the barriers and they're going to gain confidence in having one, getting help, right? It's being a little simpler than it has been for them because people's lives are on fire. So when you can handhold in simple terms and do what Dr. Robeson is saying, really walk it out. No, I'm not funded to go knock on the door, but I know there's a need. And so I'm going to meet that need because our whole community is better when one person is taken care of. And so not everybody can do that. You can't handhold for every single person that you serve or every single person in community, but you will know those times when I got to walk this person, I got to hand them and give them a warm handoff. And when you do that, I've seen so many community members, one, gain confidence enough to do it for somebody else. So we are then empowering them to help each other. And then two, they then become activated in the work. How can I help you? What can I do? And that is the way we build community and we build the trust in community. Because I guarantee this man gonna tell everybody that they knocked on his door. And just to hear that story of nobody asking what's the barrier to you having a driver's license? Nobody asked that question or why don't you have it, right? That was a simple answer. Oh, he doesn't have this, right? How can we set that up? So I think hand holding is important in this particular work that we're doing as well. Sometimes when we talk about connecting the resources and building community trust, and that's even before the questions are asked, and not to mention bringing alongside the next generation that's behind us, right? I talked about tokenism, not hoarding in one space. It always feels good when I'm on a call with Miss Maisha. She is the mother, right, of this work to us. And so she has deposited a lot of information in advocacy and community organizing and all the things and make space for us to actually do this work. And I think that's what it relates to as well, because the next generation is coming behind us with new and innovative ideas, and they work faster on a computer. I tell y'all that.
Thank you very much for that too, Talithia. I want to just say something about outreach and engagement, community engagement, that typically there's no funding for it. You have to really struggle to get someone to recognize how important that aspect of the work before you even come for the service delivery. People need to know that you're there. People need to know what resources are in a community. And that's not known unless somebody is actually working it. And most of the times we don't get paid to do that, but we do it anyway. That needs to be a dedicated position. So when you're doing your research, think about outreach. Think about the real community engagement and how that works in a community that we are describing and that we've lived it through in terms of our own experiences. You have to go to them. They have to see you. And you got to go 3 or 4 times. It's not like you have to go one time and it's done. You have to do this deliberately. And so my thinking around resources is that, yeah, they're right there. As someone said, we don't always know when you're right next door to something. We don't know how to access it. We have different issues with accessibility for whatever there may be. Transportation, typically, childcare to get to where you need to go, or just being able to do the literary kinds of things. The literacy piece is key. The language is key. All those pieces are all part of doing active outreach and engagement. So it's almost like an organizing position, something that a CHW could do easily, and particularly in moving CHWs into the workforce. That is, to me, a more critical piece when you're thinking about your work as researchers. How do you engage your CHW? So you put a line item in your budget to get you a CHW or two, and then with the yeah, or three.
Yeah, if you
Sometimes it may
can.
take somebody to do the organizing, somebody to do the reporting, and somebody to do the evaluation of how well you're doing the job. But do not forget the people on the ground. Those folks who want to get to you, who need to know those resources, and who actually have resources they can tell you about. But you need to be talking. Somebody needs to be talking on your behalf if you're not there to do so. So that's what I want to say.
Absolutely. It's beyond the 9 to 5. As we are hearing from all of these examples, it's beyond just the time that you may spend, in your office or on campus, but it takes a lot of intention, it takes a lot of heart. There's another question in the comment that I think we might end up wrapping up with, because I think it's really great. It says, how can we be sure all voices from the community are represented? Many times it's the same people that speak for the community. So what are some things we can do to intentionally hear new voices or hear all voices? I know a few examples just shared were about, even just training up the younger generation or new researchers and bringing them in. But what are some things that if researchers are trying to be intentional about hearing multiple voices, because everybody may know you three, right? They may even know, like, okay, these are key voices, but there are some new voices that we want to hear as well. And so how do we go about ensuring that we get new voices heard, and all voices that represent the entire community, those who may, be living with disabilities, those who have special needs? How do we ensure that all voices are being heard in our research? You're on mute, Ms. Naisha.
It's the engagement part of it, intergenerationally, and how that works. Because a lot of times, some of our elders aren't able to get out to go to places, but they have strong opinion about things. And so the engagement of the young people, the middle-aged folk, as they say, everybody who is part of that family should have some role in engagement, because we have to continue to move forward with the work that started, so it doesn't end with some of the older ones. And that's one of the fears that I hear from a lot of the senior citizens, that my voice isn't heard. I am not able to get to the places, and because I'm not coming out at 6 o'clock at night, it's dark. Hey, I live alone. I can't trust that. So there are certain ways in which if you have a group of people who are talking in a community, they'll come up with something for you to help you recognize what is necessary to get them to come to be part of it. But again, it's a lot more than just bringing a meal to the table, which is always good. This is the first thing. You always should do things around food. So
Yeah.
make sure you got food in your budget. Don't think the people got to struggle, because they'll exit out. And if it has to be around nutrition, make the language work for you, because people need healthy food options. And so that's one place they can get it. They're talking to their researchers on an ongoing basis. They can know they're going to have a great meal, but they're also going to have an opportunity to have conversation intergenerationally. Their voices will be heard. And that's the most important thing that I've learned over the years, is that coming back, even when you've done the research and you've done it and got all your people together, showing up and coming back and tell people what was done. What happened with that research that you did? What happened with those great objectives that you had? Did it work? Did it not? What other things we need to do to change to make it better in our community? But let us see some change. We've seen so many activities that go on year after year that we don't see change. We just see movement and action around questionnaires and surveys and more of the same from 3 or 4 different institutions, not just one a year. People knock on our doors in our community. I'm in 32304. I mean, we get door knocking all the time. You want to be participating in this particular thing? You try, you want to, but you can't do it all. So help us out, researchers, you young minds. You are challenging us to some degree to think big, and look at outside of what is normal to you and at the university, but also it's a community university partnership. And if we align the idea of what collaboration truly means and what partnership is expected to have as outcomes, then we'll be able to move this whole notion of this difficulty that we all share. How do we get our people involved? We won't be able to worry about that if we had taken these principles that Ericka talked about earlier on and applying them and addressing the ways in which we've asked you to do today and take a different view on things.
Yeah. And the one other thing that we have not talked about, but I want to talk about real fast is like I created a course, Public Health Communications at Brown University. I created a curriculum, created a course, but for researchers, young researchers, you got to know how to talk the language in the proposal
You
to
sure
be
do.
able to be funded to help people.
Oh,
That's a whole
yeah.
different talk and a whole different conversation. But
Mhm.
understanding the current landscape and how to ensure that you don't inadvertently not have a population be funded for intervention because you didn't understand the change of the landscape and communication to be
Right.
able to work with the communities that you want to work with. So I feel like there are some additional conversations that should happen with young researchers, existing researchers, on how to talk about contemporary things that are going on so that we can still go about helping communities in need. So,
Yes.
like I
Yes.
said, with young researchers, it is important that
Mhm.
we realize where we are so that we're able to still help people. But, Dr. Horne, I know she'll get together something else so we can talk about
She sure will.
communicating to ensure researchers are still funded and can still do this type of work.
Right on. All right on. Thank you for sharing that.
You're on mute, Kate.
I was just agreeing with that. As I said, I'm a translator. I said real simple. We need the language to get the resources. I translate to community. Hey, this is a good thing. This is why it's a good thing. This is how we got to do it. But Dr. Roberson is head on. We have to know the language of what's
Yes.
happening and what funders are looking for, what government entities are looking for. I share just a small example. I do federal grant reviews, and
Mhm.
when the landscape changed in the nation,
Hey.
literally Title 5 grants, y'all, that fund all the like maternal child health, all the stuff,
Mm.
states had to redo applications because of words like
Mhm.
transition. It wasn't even talking about like
No.
gender assignment and sexuality. I mean, the word transition, like different
Hmm.
things, like simple things, right? And it was frustrating because to a lot of people, but you roll with those punches. How do we communicate in order to continue to do the work that we're doing? So Dr. Robertson hit on a great point about that. You do need the individuals like myself who is not a researcher. I understand and I can read it, but who can translate it. But you got to continue
Exactly.
to get the resources pulled down for the work to happen in community. So just great point.
And Talithia, to your point, those 100 words or so the National Science Foundation has put out that say they're red alert words for nonprofits so that you can't use when you're asking for funding. So get to be familiar with those
Yeah.
words that are restricted right now, that are tying our hands in the community from doing some of the work we've been doing. We had to rewrite and redact a lot of our proposals now, like she said. So check that out and make sure you're on top of the changing scenarios and the trends that are going on around health and especially around cultural issues around equity, diversity, and inclusion.
Right.
Lots of words have been redacted, taken out, removed.
Yeah, they don't like resilience no more.
Oh
I'm like,
no! Whoa,
no,
whoa, whoa!
we don't like resilience.
Oh no, marginalized and under resourced. Oh,
Yeah.
watch out now. Things like that.
Staying current is key, especially as a new researcher, is really staying abreast of what's happening on a daily. We did have one more question from Jules Bailey in the chat. It was just an individual question. Do you ever work with local public libraries? Currently, Jules works at FSU, but used to work as the librarian at Leon County Public Library. And when people can't figure out how to fill out forms, and we were talking about that earlier, or they can't do something online, they usually go to the public library and ask. And so Leon County has a social worker or a community resource specialist stationed at the main library, and they carried handouts with lists of local resources for people who needed help. Anecdotally, they know a librarian who used to work in Gadsden County, and they were told in 2017 and 2018 that people would go to the public library in Gadsden to use Wi-Fi on their devices because many still had dial-up at home. So just thinking about what people are using the library for, even in the different areas. And then just a question of, have you ever, worked with the local public libraries or considered any work around that?
Right.
Yeah,
Right.
I knew our library is full of resources here in Tallahassee.
Yeah.
So of
Mhm.
course we work with the library. They actually have a new room. They just did a tour, UPHS did a tour for community members to bring us really back to the library as a community asset because most of us were always looking for spaces, a whole bunch of space in
Mhm.
the library.
Mhm.
But I think we have to be intentional about mentioning the library. I remember as a kid, I went to the library all the time. That was I didn't go to a community center because I lived in an apartment, so I didn't, I didn't live in an area with a community center. So the library was it because it was close by my
Right.
house and there was a lot of programming around it. Even when I had small children, there were day programming around the library. And so because of these little, as my mentor, God rest his soul, would say, computers that fit in our hands, we tend to forget that the library is full of resources, right? We're looking it up here. So that person that brought that question to our attention, yes, I do use the library, but I think we are underutilizing the resource of a library and could do a better job with connecting community to the resource that is the library.
And in the rural area that I'm working in Greenville, the library got destroyed during the storm. So currently we don't have a
Wow.
library. They are in the process of getting contractors to fix the library up. But ever since the storms happened, the library was damaged. So that community is dealing without a library right now. We
Mm.
just received a donation of books from the Madison County School District. And so we are working with our space to like put up bookshelves to bring books so at least kids can come and read and get books from the community. But in some of these rural areas, like I just told you, we don't have a grocery store, we don't have a
Right.
library, we
Mhm.
don't, no restaurants there. So we are dealing with some issues that wouldn't traditionally come to mind. So we picked up books last week. We're picking up books tomorrow and we're putting up shelving in the building that we have so that we can give people access to reading again. So there are
Yeah.
some true challenges that we're facing in
Always.
2026 that I didn't even face back in the 80s and 90s.
Well, technology certainly is one of those. And I think about the intergenerational aspect and the value that our youth could bring to this discussion because everybody has a phone. And having more classes where our elderly people understand how to use those phones, they have these phones, they don't know how to use them. All they do is use them for calling and getting calls. But there's so many ways that they can find a library online, but we have to teach it. That has to be a part of our education as well. So put technology and how the youth can share with the elders around the intergenerational approach.
Yeah, and we got a little rollback situation in rural areas with phones because there were a lot of free programs that
Yes.
included phones that like right now we're seeing some people that come in the resource center, they don't have phones
Telephones.
anymore. And
Mm.
all of the children, like it's a little bit different. My daughter goes to school in Tallahassee, everybody have a phone, but in the country, it's in the country, that's what we call it. But in the rural areas, everybody right now, they
Doesn't.
don't have a phone. The money is kind of tight.
Yeah, I got you on that one. That's important. Researchers think about connecting technology. Maybe that's something goes into your grant.
Yeah, I wrote in conjunction with some other researchers with the American Heart Association. We published a paper, I think it was last year, where we were talking about digital determinants of like cardiovascular health
Mm.
and at broadband issues, et cetera, but really talking about technology divides and
Yep.
how we can, like figure out different solutions. So that conversation is, it should continue and additional research is needed to better understand how to like close those digital gaps.
Good
Awesome.
point. Good
Very
point.
good. And the last question, I don't know if we have the right answer, but it says, what are the new acceptable words? I think really what you should just look for is the list of the words that are unacceptable and then really go from there. That's what I can provide as a safe answer for us. But yeah, I would say just look for what may not be acceptable in these terms and then work around that. That's the best I think we can provide in this moment.
I think
Mm.
that's great.
Yes, really, because it's something different
Yeah.
out there every day.
Uh,
New words are
yeah.
being added that you can't use. So
So that's why you have to stay abreast of what's going on
yes.
daily, and so you can always be abreast of what's happening. But yes, are there any final questions? I know we had a great discussion today. I just want to personally take the time to thank each of you, Talithia, Dr. Roberson, Miss Maisha, and Miss Wiley, even though she had to leave a little early. Thank you guys so much. Let's give them all a round of applause. There were a lot of great gems shared, a lot of knowledge that was shared. Thank you for allowing us to be able to, tap into your brains a little about the work that we're currently doing, what researchers are doing, and how they can be more inclusive of the community and including community engagement in their work. I'm sure if it's okay with each of you, we'll share your email address if that's okay. So you may receive follow-up questions just for communication's sake. But I just want to take this time to thank each of you again for coming out to this afternoon session. Amazing panel. And Andrea did drop the evaluation earlier. So as we talked about, evaluation is key. So please click the link and complete the evaluation from this afternoon's panel. We hope it was something that you guys are able to receive great information from. And if you have any questions, please feel free to reach out.
Sure. Thank you, guys. Appreciate you.
Thank you.
Mhm.
Thank you.
Everyone. Stop recording.